Welcome, everyone, to the Ultimate Men's Movement. I'm Dr. Jack Rocco, your host. I'm here with Dr. Victor Loria. We are down in Miami. Been down here for a week doing some more training and brushing up. So welcome, Victor. We've done this once before, and we had great success with that. We went a little viral with your responses on the male enhancement. So we want to give everyone an update. We've done some additional procedures. Dr. Loria has a sleeve procedure that we've done a few on. Um,
We had
why
a
don't
busy
you go?
week, busy week.
Oh yeah, we had 4 or 5 cases each day. Where were the people from? We had a number of patients from all over the country.
Yeah, a lot of patients come from both coasts. They come from Canada, California, Wisconsin, wherever. They just find out about us. And the good thing is, the reason why they come is that there's a lot of doctors that do temporary filler, which is fine. You can do temporary filler, but they don't want to spend a lot of money every year because you got to do it every year. So when they find someone like myself who does permanent filler, I mean, that's it. They kind of beeline it right to us because they say, hey, if I can get this to last a few decades or a long time, they prefer that.
Yeah.
Bottom line.
But we did, yeah, it was California, we had South Carolina, Texas,
Wisconsin.
two from Wisconsin this week. So, I mean, I got to see firsthand,
Oh, yeah.
you
They
know,
come.
the volume and
The key is when they find out what you do. I
right.
mean, you're in Boston. I mean, they'll come from Singapore. I mean, I had a patient from Singapore, Philippines,
Mhm.
Africa,
Yeah.
Spain, South America. When they find out about what you're doing, permanent, right?
Yeah.
And you have results. Obviously, you gotta have results, and they have that comfort level because this is an important part of your body, right? So they want the best, right? They want the best and most experienced doctors and so forth. So I've trained you and others that do very well. So that's who they're going to go to.
Yeah.
That guy.
Right. For me, it's been a transition. What you find is that, like I said, as an orthopedic surgeon, I spent a lot of my life working on form and function. I can't lift my shoulder. You can reattach a rotator cuff to improve your function. But here we find a lot of a lot of relationship issues that people come. And when you think about it, your sex and genitals, are the source of a lot of relationships, enjoyment in life. So it's not so much form and function, it's form and enjoyment. And
It's a real issue.
talk about some of that, because I thought we had some really heartbreaking stories that we talked about this week with the patients while they're on the table. Go on, explain some of
Yeah,
that.
I mean, we had a patient, it's pretty sad. He was married for probably 20 years, had several children, and his wife left him because of his penis size. All right.
And
Now that he has a girlfriend, his girlfriend wants to leave him because of his penis size. So it's a very real problem. It's a very real issue. Even though women probably, I don't know, probably most won't mention that because they don't want to hurt the guy.
Mhm.
But a lot of them probably leave or are discontent because of the size and why. When you have intercourse and you have a vaginal space to occupy, right? And if it's kind of like a smaller size member, right, penile shaft size, and the vaginal space is above average in size, that's a problem because you don't feel anything, right? You feel very little,
Mhm.
and that goes for both of them because the man won't feel so much, and the woman's not going to feel so much. So where's the pleasure in that, right? That's real. It's a real issue. Now, the key to that is simply enlarging the penile shaft, right? You get girth, whatever, let's say 6, 7 inches, even up to 8 inches. It depends on the vaginal size you want to accommodate. It works phenomenally well for not just the ladies, but for the men.
Mhm.
And we talked about emotional stuff, and men do not like to have a small penis. I don't care who it is in the world. We could have a conversation with a guy in the Congo River right now, and we could talk about this. He's going to understand what we're talking about, okay? Because he's dealing with it too.
Well, how about the one guy we had? He went back to his childhood, to middle school. He says, but he goes, there's a lot of these issues go back to when I was in school in the shower.
Oh,
I mean, he came
was
right
a
out of
wrestler or
yeah,
something. He was an athlete,
yeah.
and had to go in the shower. In fact, even worse, I had a guy very talented that he decided not to play football because he had to go in the shower. Because he had to go in the shower.
Yeah.
He didn't want to expose himself and his smaller member there. And he just totally, I mean, he could have been an NFL player, this guy,
Yeah.
but he just decided not to do it because he was embarrassed. right?
But it's also, it's not, I think one of the things that I'm not necessarily surprised, but interesting that it's not just small guys. We had some very well endowed guys that they come for the treatment as well. They want a little, who doesn't want a bigger size?
The mentality is bigger.
Right.
And what poisons us, unfortunately, is the pornography industry. The pornography industry, you see all the big guys, and the women are having this great experience with them, which is not true because they don't like long penises. Women don't like long penises, but they're good actors. So when they have intercourse with a guy with 10 inches long and the girl is screaming, really in pain, but she's making believe, that she's enjoying it. And these women, and I know this because I speak to these guys because I help them out. They want to be bigger too, believe it or not. These women actually go home to their 6 inch long boyfriends, but that are thicker because they prefer to feel something and have pleasure, not pain.
Mm-hmm.
So don't be fooled by those pornography videos because it's really not right. It's totally bad. It's just bad. It's bad.
Yeah.
It's impressive. It impresses us in the wrong way.
Yeah.
So
And once again, to go through the whole gamut of what we've seen this week, and we're talking right now about the enhancement procedure, which involves what exactly is the material? What is you hear about silicone and whatnot, we learned today from one of our patients. He was in the gay community, and he said that he had a story about someone who was injecting themselves. So like this is apparently an issue on the streets, people injecting themselves, but that's not what we do here. That's not what you do. Tell us about the quality of the silicone and the material that goes in and how you get this silicone material to build that permanent collagen that we see in there.
well, going to back to the self injectors, men are kind of desperate in a sense. They want to get this done. Maybe they can't afford it. I had a guy that was in jail that wanted a bigger penis, and he wound up taking this piece of PVC pipe, cutting it, shoving it inside his penis, believe it or not. Yeah. He made a little incision and shoved it in. Point being that guys desperately want this. Okay. I mean, that's
Yeah.
pretty desperate to do something like that. Okay. But going back to what we do and so forth, um, when I was researching this, now it's about 20 years ago, I said, how do they do penis enlargements? I was looking into this, right? And there was a procedure that was done that I thought I was appalling to me, that they actually cut skin off the behind, open the penis and stitch the skin in to make the penis larger. And I thought that was barbaric in my view. So I started doing research, and I'm a chemist at heart. I was in pharmacy school, but I was looking into something permanent, like permanent filler type drug or injection medicine. There was a doctor out in California, Dr. Derek Jones. He's been using silicone in the women, the facial area for women to plump it up, make it a little, bigger cheeks and so forth. So he was using silicone oil. It was medical grade pure oil into the skin of the face. Now I did that too. I wanted to try that and see if it worked, and it did. But I said to myself, well, if we can make the cheeks bigger, why can't we make the penis bigger? And I just had to modify the oil, and I had to put it in a different solution to inject it in the penis. It's a little different, but it's the same concept, delivering little droplets.
Mm-hmm.
And the purity of this product is super pure because the way the way we mix it and all that and compound, whatever, it's a high quality, pure product. And what it does is when you inject it, the body sees the little droplets of oil and it surrounds it with collagen. So you want to put a collagen sheet development. Okay, so it really works out quite well in regarding to building up natural tissue. That's what I tell patients. You're building up collagen. So if you were theoretically, let's say you had a treatment and you got from 5 inches to the size of this cup, which is probably 7.5 or 8 girth down here. Some guys get this big, sometimes they're even bigger. If you were to cut into it theoretically, you cut into that, you're going to see wonderful, beautiful collagen tissue.
Mm-hmm.
You don't see oil. There's
Right.
no oil. I mean, the oil is embedded within the collagen, but they're so tiny, the droplets, you don't even see it. And that's the beauty of it. It's a tissue builder and it works well for the penis.
Yeah. Now we also the last visit that I was here, I didn't get a chance to see your sleeve procedure. You call it the LEEP procedure, LEEP, correct?
Yes, yeah, the LEEP procedure entails two types of procedures. It's erect lengthening via release, suspensory ligament release, and the sleeve procedure, which is a flaccid elongation treatment. It just optimizes the flaccid length.
Mhm.
So that's what the LEEP procedure is. It's two types of procedures.
Right.
And depending on what you want, you might say, I just want erect length, so you do the suspensory ligament release. If you just want the flaccid length, which is more popular, by the way, but if you want the flaccid optimization, then you use a sleeve. So let's say, for example, let's say your erection is 6 inches and your flaccid state is 2 inches. So no one likes that, to be shrunken down.
Yeah.
What the sleeve does is the sleeve goes in and keeps you hanging 6 inches close to it. Now that's a good look, right? So you're not shriveled. You're never shriveled. So what we do is we have the patient do a couple of filler treatments to build up the collagen. We make a small little incision, right, just under the glands, slide in the device under all the collagen because you want to conceal the device, even though it's small, it's soft, you still want to hide it. So you do 2 collagen fillers, slide in the sleeve, and now you have a substantial penile size and how it looks flaccid.
Yeah. And it was impressive to me, we talk about the collagen formation, but when we do the enhancement procedures, it's an injection, and then you see the results when the patient comes back into the office. But when we did the LEEP procedure, you're inserting a little sleeve of silicone material as well.
Silicone rubber.
And Dr. Loria fashions it in the way, and we'll be doing this at our clinic as well. You make the little incision. You can see that layer of collagen. It's a beautiful white sheet, that gives some thickness to your skin, in a non-surgical penile. That the distance between the skin and the working elements is very small, but this was a nice substantial thickness to it, 1/4 inch or so. And then you slide that underneath, and that really gave, added more girth, um, you know, and a smoother
Well, it extends the penis out.
extent. Yeah, so you're
Its
getting
primary
lengthening,
purpose.
you're getting lengthening and
Flaccid lengthening or optimization. You're getting increased girth by not just the sleeve itself, but you have a capsule that forms around the sleeve with some hydration, some water, right, which is natural. Okay, so it hydrates. So you wind up getting a 1/2 inch to an inch increase in girth. And that's important to tell patients because if they're at a certain size and they get another inch, they have to be aware of that just to make sure they could fit in their spouse, for example, right? So they got to plan for that. But the sleeve goes in, you get optimal flaccid length, you get more increased girth. You get also, for those with erectile dysfunction, low levels of erectile dysfunction, right? You get more firmness, and that helps the older guys.
Yeah.
Okay. So you get all that. It works out very well, and they really love it. The guys love it. I mean,
Yeah.
it's a wonderful device. It's a simple device. It's a very soft silicone sleeve goes in, and that's it.
Yeah. I mean, so you have multiple ways to accommodate what the patient wants. The sleeve procedure, the along with the enhancement and complications. People always, I think people want to know, what are the risks of this? What are some of the complications you see? Are they significant? Tell us a little bit about that.
Any procedure, doesn't matter what it is, when you breach the skin, you have to think of bacteria, right? I don't care what doctor it is in the world. If you're doing an injection, you do open heart surgery, it doesn't matter. The idea is to eliminate bacteria, right? So the thing we're concerned about with mainly surgical, not necessarily injection of filler, because that's rare to get an infection, really. It's the any kind of surgery. So what we do is we try to purify the air in the room, sterilize everything, do the proper things to prevent infection. So that people say, what could be a complication? Well, obviously infection, no matter what. I don't care what procedure it is, infection. So we try to mitigate and limit that to 1%, something very low. So I wouldn't want any of my patients to worry about that. But I'll tell you one thing, talking about complications, the one challenging procedure we have is the release. The release is where we separate or release the suspensory ligaments, right? So if I could just show you with my hand, let's say here's your pubic area and the penis is attached. And here's like the penis sticking out here. The penis is attached. What we do is simply separate. You notice how my arm is lengthening, right? Because I'm separating the ligament. I'm separating the ligament and flap kind of moving the penis down and you get longer. But what happens is the body, it basically tells us, hey, the penis is going to try and go back home. It's going to try to come back and reattach. That is the challenge. It's easy to separate, no problem. Okay. But it wants to go back home. And the only way to deal with that primarily is to put a stretching device, which is not very comfortable. And it's not too many patients really use it. They're not really compliant. But the bottom line is, if you don't use that stretcher, we don't have a shot.
Yeah.
And it's sad, but it's funny. I can say I'm excellent at doing that release. I got to.
But
it's perfect.
But if you put it back, like any other tissue, it's going to heal.
The body heals back.
Right.
So in other words, what I tell patients is, look.
But that's something you can maybe prevent by putting some traction on it.
No, the idea is to put traction.
Yeah.
The thing is, the patients sometimes are not compliant. They don't like wearing the traction device. Mm-hmm. So what I tell patients is this: if you're under 5 inches in erect length, I'll push you to do it. Take the risk of it coming back, because you can use that inch. But anyone over 5 inches, I say, you know what? If you really want it, you do it. But just so you know, you might get an inch, you might get 0. Bottom line. Yeah. And this is across the board. This is not just with me. You know what I'm saying? This is anyone in the world doing suspensory ligament release knows this.
Yeah. The other thing that we saw that I thought was interesting and had a great solution to it is that some people can get little lumpy bumpiness to the finish. After you've had the injection, you get the size, but you're like, doc, right here, I feel a little pee, a little, and they come in 2 forms. One form can be just pure collagen, correct? And another, we saw a couple of these this week. It's a little collection of oil. And it was a real simple fix. It amazed me. Yeah. He was like, okay, feel that. I'm like, okay. And for me, in my orthopedic mind, it reminded me of like a ganglion cyst in the wrist. You got a little cyst, wrist bump. And Dr. Loria took an 18 gauge needle and just punctured it. And we were able to squeeze that oil, that gel out, that little seroma, and it was gone. But so that with the liquid ones, you can cure those with an injection or a needle. And with the firm ones that are more just pure collagen, if you don't get fluid, you can inject those with cortisone, Kenalog, which helps to soften it. So, the complications, you're right, you got infection, which can always happen, but extremely rare in the injection procedure. The LEEP procedure, maybe, slight increased risk, but also rare, but can happen with anything. And technically we're doing skin procedures here. So this is not much, we're really not going into the working elements of the penis. It doesn't affect function, but it's a skin procedure. And the penis it's perfect for this procedure because God built in that extra skin to accommodate the erection. So that skin is available there, and you just exploit those, that anatomy.
That's a good point. We only work skin deep. The blood flow going into the penis that causes an erection, that's the inner part of the penis. We don't touch that. The nerves involved in that part of the penis, we don't touch. In the vasculature, we don't touch. So it's skin deep. So guys shouldn't worry about that. It's truly skin deep. But let me touch upon the nodules, because patients will get, not all of them, but some will get these little bumps, right? A little nodule here and there, and they get worried. But we tell them not to worry. There's 2 causes, or there's 2 reasons why that develops. Number one, as Dr. Rocco said, some of them could be collagen. Now, why would that happen? When we layer in the filler, right, we expect the collagen formation to be flat, right? That's the objective, flat and smooth. But if it develops in a round pattern, well, guess what? You could feel it, right? If it's flat, you can't feel it. You say, oh, everything's normal, everything's good. But if it develops in a round pattern, and sometimes we don't have control of that 100%, then you might feel what's called a little nodule. If it's a collagen nodule, and if it bothers you, we might inject a little Kenalog to dissolve it. Okay, that's that one. And also, Dr. Rocco mentioned the other type of nodule, which is just pure liquid. So why would you get that? Well, why would you get a nodule that's just oil, for example? What happens is when we put the filler in, the body has to process it, right? So it sees all little droplets of the silicone oil, and it surrounds all those droplets nicely and makes a sheet of collagen. But if the immune system's a little sluggish and there's a delay in encapsulating all those little droplets, those droplets have a chance of coalescing, coming together and making a bigger droplet. And all of a sudden now the body will surround this bigger droplet. If that droplet gets too big, that's where you get to feel it. But don't worry, all right? Patients shouldn't worry about this because it's an easy fix, like you said.
It was a very easy
Poke,
fix, yeah.
drain it. It's pure sterile oil coming out, very simple. We squeeze it, and all of a sudden it's flat and gone, disappears.
And you've also told me that, a number of your patients traveling, they go home and they're like, hey, doc, I'm back in South Carolina and I noticed this little nodule. You'll talk with these patients on the phone, do a telephonic consent. They can get a needle, and you've instructed patients on how to do this at home.
We can do FaceTime, for example.
Yeah.
Let's say someone says,
It's
hey, I
that,
have a little
it's that
bump.
simple. I guess
Yeah.
the point is that it's simple enough that,
So if you hear about a patient getting a bump or something like that, well, it's par for the course. I mean, some get it, some don't. But the thing is, there's a remedy. That's what the patients have to understand is that, number one, know what it is and understand the remedy as well. Now, some patients don't care, In fact, I had a patient, this was a funny thing. He formed a few nodules, and he said his girlfriend liked it. It stimulated her, right? As crazy as that, I said, you want us to remove that nodule, whatever, a couple nodules? He goes, no. My girlfriend likes it.
It's like a French tickler.
Exactly.
Someone made that comment, one of the
French
patients
tickler.
made the comment.
In fact, some men put pearls underneath their skin.
Yeah.
Right? You've seen that? Have you seen that?
I actually had a patient who was a correctional officer, and he got the procedure, and he told me, he said that he goes, Doc, have you ever heard of cock rocks? Have you ever heard of this?
Not that term, but I know what it means.
Like I said, he was a correctional officer, and he said the guys in prison will take dominoes,
Shove them underneath.
take the circle, the white part of the domino, and someone in the prison will make a little incision, put it in there. And I'd never heard of that. But you're right. There is, we get into fetishes, taboos, various things that people do. We talk very openly about these things. And it's nice. It was great today. We had a couple patients who really got into their relationships, problems they had with sex and their marriage. Guys had, we had at least two guys today that really had to vent. They liked having two guys to talk to about their issues. And that's what you do more, pure procedural, but I do testosterone and some relationship. We've had a lot of conversations about men's mental health, and I just like that men feel comfortable talking to us. There's a place where men have to go and, say what it is, to say, hey, my girl is too shy, too aggressive. What do I do? How do I, it's a great problem solving. So what else can we talk about? I mean, I think we touched on a lot. Why do you see people coming in? People come in more just to enjoy sex better, to function at sex better?
Yeah, I would say that a couple things, right? Let's talk about that. The men want to feel better about themselves. They want to feel they're effective. How do you feel if you have like an average size penis? You're having intercourse and you're barely feeling anything, and the ladies, you think she's faking it, just to make you happy, whatever. That's a terrible feeling. Okay. Nobody likes that. Nobody. So this is for the guys to make them feel better and more confident, right? So when they go into the bedroom, they're kind of have that control and that, and confidence, really, the confidence is the key. And the ladies, I mean, I got many stories where, the ladies actually love that. They absolutely love it. And it has saved marriages, relationships, and so forth. You're talking about someone, if we talk about orgasms, right, and so forth, you'll hear that their partner would maybe have one. Now they have 10. And I'm not kidding either.
Mm-hmm.
You're talking multiple. So it's good for everybody. I think it's good for a marital relationship situation where it strengthens it, which is important. It builds up the man's self-esteem and confidence too, because he doesn't want to feel like, and so forth. He doesn't want to feel bad about his body. So another thing is that the women perceive that. They see their man changing and they like it.
Yeah.
They see a confident man and they like that man better.
Yeah.
That's real. This is all real.
Right. And I've had patients, my own patients, the wives come in and they're in the waiting room, and I said, well, this will be a couple hours. I make some recommendations for places they can go for lunch. But I love that when the spouse, significant other, girlfriend are coming in and uh, they're doing it together, so I think that's wonderful.
It was, it was a funny story. I had a patient come in with his girlfriend, and we were talking about his third treatment. He wanted to say, "Hey, do you think I need a third treatment? Whatever, whatever." So while we're talking, she rudely interrupts us. She says, "Hey, wait a second now. If I break up with my boyfriend, do I have to call Loria Medical for a referral?"
For the next boyfriend.
Yeah, because you're not going to find these sizes out there, really. I mean, this is not common. I mean, you're talking
So
like,
she wanted to hold on to that man,
yeah, or
physically
if
and
not,
literally.
how is she going to get another one? That's the point. How is she going to get another one? Because
Well,
she can't, once you once you go to the bigger size, it's hard to go back. You know what I'm saying? I don't want to use that
that's
other phrase,
no, I mean that's
but it's
how
real.
interesting.
Yeah, yeah,
That's, you know, so
yeah.
the
It's real.
women, I got myself a Loria, vitamin L.
That's too funny. But this is all real.
Yeah, I mean,
It should be known. It should get out there.
right.
The guys need to know that.
Right. And I think people need to talk about it. I think, sex is important. We're all products of sex. We all have, relationships, good ones, bad ones. And it's something that, I was thinking we talked a little bit today, during medical school, the amount of time we spend on the vagina and the penis is minimal. There's very little training and education in medical school, and a lot of people don't understand their body parts. What is an orgasm? I mean, I think there's a lot of myths and misconceptions. And I feel blessed to be in a position to help people make these decisions and speak to them from experience and to hear other people's stories. I mean, I think a lot of how we learn, I learn more from my patients sometimes than
Yeah.
I teach, but also by teaching other patients. How many people come in and ask you, Doc, is this normal? Am I normal size? What's normal?
Well, it gets even worse because let's say you feel kind of small, right? So you go to your urologist, for example, okay, and you say, "Hey, doc, check me out here. I don't know." So he checks him out. He goes, "Okay, can you urinate? Yeah, okay. Can you get an erection? Yes. Okay, then you're fine. I mean, your penis could be this big, and you won't mention the size, right? Does it function? Yes, but the size is never really mentioned. Like, hey,
Yeah.
maybe you can benefit from enlargement. I mean, look, it took decades just to break into the erectile dysfunction thing, right? When Viagra hit the scene, right? It broke the ice there and so forth. So we're getting closer to understanding that, having a smaller member is not optimal for here either. And it needs to be addressed. A lot of doctors should address it. Like, for example, the urologists should say, you know what? If you're concerned about your size, look into enlargements because it's out there. But that's not really being done yet.
Yeah.
So we have to break the ice. We have to push, get the word out, okay, let more people know. And the other thing is, like when you do a patient, right, he gets larger or whatever, a lot of them don't tell anybody. It's not like women.
Right.
They got these nice breasts now.
Yeah.
Everyone sees them, and they're going to talk about it. Okay, they're going to talk about it. Man ain't going to say, "Hey, I had my penis enlarged." And what are they going to say? "Oh, you had a small one." Yeah, they're going to make fun of them.
Yeah,
Okay.
no, it's definitely very, and the amount of money that, I mean, I worked for Sono Bello for 2 years. I did over 1,000 liposuction cases. The women were just flowing in with these procedures, and glad to talk about it and glad to, share. But a guy wants to buy himself an extra special side order of fries with his lunch, and he feels guilty for spending money on himself. A lot of guys, but I think there are guys who are interested in spending money on themselves, but it typically is involved with pleasing their partner as well. That it's not a purely selfish thing. It's something that you're doing for someone else, and
As
you're
well.
both enjoying it and opening up the conversation. So many places we can take this. But thank you for your time and thank you for your wisdom and training and razzing. We were talking. He's like my Mr. Miyagi, and I'm Daniel-san. He's like,
Right, right, right.
come on, Jackson, wax on,
I
wax
have him
off.
painting now. He's starting to
Yeah,
paint.
waxing his car after work. So we had a good time, and I appreciate the relationship, the camaraderie. Feel comfortable calling you, and taking advice and collaborating back and forth. So I'm glad for this relationship. It's been nice. So. Well, thank you once again there's been another episode of the Ultimate Men's Movement brought to you by the Ultimate Men's Clinic. I'm Dr. Jack Rocco here with my partner and friend, Dr. Victor Loria. And if you have any questions or concerns, you can get a hold of either of us in Miami, in the Boston area. We're ready to serve. So thank you so much.